Okay. So I just want to thank everyone for coming, taking the time to log in today for our virtual face-to-face. These are new, it's a new program that we have started at the PSC. It's an opportunity for us to get together. If we can't get together physically face-to-face, it is nice to at least get together virtually. Each month there's a different topic that we're asking you to join in, and it's great because if you're not interested in that topic, you don't need to join in. So next month is teens, and we're hoping that we can get all of our teenagers to log in and hang out with us for an hour, for them to get to know each other, as well as for us to understand what the needs of the teen population is for the organization to help them. So today we know that this is our face-to-face research meeting, and I first want to introduce everyone. We have Dr. Dawn Siegel, who is now at Stanford. And we have Dr. Anna Kerr, who is in Ohio. Both actually, Dr. Siegel and Dr. Kerr are both actually PSC board members. So they're serving, they have a couple different hats, and today they're wearing their researcher hats. We also have Mitchell Braun. Mitchell is from UCSF. He is a medical student and a research coordinator with the Pediatric Dermatology Department. We are always thrilled to get these young, enthusiastic individuals involved. And so we hope that Mitchell will be someone that we'll see for a very long time being involved with the PSC. So we're just really excited to have everyone here today. So Mitchell, can I throw it over to you? Were you going to do an intro? Okay.
Yeah. So thank you for having me here. I'm really excited to be able to kind of just talk about research and talk about the project that I'm specifically working on. And like Maureen said, my name is Mitchell. I'm a medical student at UCSF, and I'm working with Dr. Frieden and Dr. Mathis, Dr. Siegel, among many others. And so today we wanted to kind of just provide a really basic overview to the research process, understanding that many of you may have experience in research. And we also wanted to specifically emphasize how patients, parents, and families can get involved kind of each step of the way in creating new research. And then I'll highlight the study that we have going on here at UCSF and at other sites around the country. And then Dr. Siegel will talk about some kind of recent publications and go through what we've recently found. So just a basic kind of research process approach. The first thing to do in a research project is to kind of think about what we need to know or identify the need. A lot of times this comes from people asking questions in clinic visits and hospital stays. We don't know all the answers. And so kind of coming up with, what we need to know is really the first step. Once a question is brought up to us, or we think of a question ourselves, then we go to the literature and just do a lot of reading. So we'll read book chapters, recent publications. And then from there, we can go to number 3, where we clarify the research question and figure out our specific goals or our specific aims to research. And then from there, we decide the best way to study the question. There are many different types of research studies. We can focus on numbers, and we term that quantitative. You can talk to a lot of different people and kind of summarize what each person's story is, and we tend to call that qualitative. And under each one, there are multiple different types of studies. And we decide on the best study approach based on the research question and what we want to ultimately find. And then from there, it kind of goes into this almost like event planning stage where, we have to decide on how many participants we need, where we're going to get them. We coordinate a lot of schedules, and we come up with basically a plan. We submit things to IRBs, which are basically institutional review boards that kind of help us approve research processes and make them kind of the safest for everyone involved. And then once we do all of that, we start collecting data and doing the study. And then that can take multiple months, multiple years, depending on what we're doing. And then once we get all that data, we look over it, we do statistics, and we can bring in other experts into this stage to help us find patterns. And then finally, we write the reports, we publish things, we present them at conferences and meetings, and we just talk about it. And then the cycle continues, because at the end of many research projects are more questions. So to give sort of an overview of this process with the study that I am working on, and we are currently enrolling people as well. So our new study is the PHACE long-term outcome study, ages 10 and up. Many people who have been affected with PHACE, families, patients themselves, have asked questions about, what's going to happen over time with this condition. So what's going to happen when I grow up, when my child grows up? Will they have symptoms? Do they need to go to the doctor a lot? Among many other questions. And so that motivated us to think about what we call long-term outcomes. So long-term, over many, many years, and outcomes can be related to many of those questions in regards to symptoms, quality of life, basically what happens with PHACE as people grow up. So the research goal, we went into the literature and we talked among many experts, Dr. Frieden, Dr. Mathis, Dr. Siegel, and many others. And we identified topics of interest that we specifically wanted to dive a little deeper into. So we're asking questions about hemangioma residua, headaches, changing arteries, and asking questions about medical care, how many office visits people are going to, how many times they're getting imaging studies done, or other tests. So the general timeline, I'm sure this study was kind of thought through way before December 2020, but kind of in the fall and winter of 2020, we had a lot of discussions on how we could make the study happen and what we needed to do in order to answer our questions. So we decided to do a combination of chart review, where we just kind of look through medical notes to collect data on initial diagnosis and anything that has happened since. And then also a parent and patient interview, kind of in the moment, to ask how things are going with people with PHACE who are ages 10 and older. So between December and July, we then kind of finalized data collection tools to make sure that we were all collecting the data that we needed to answer our questions. We submitted the IRBs, which again are kind of the review boards that help us decide on final procedures. And then we started recruiting sites. So now we have 18 sites around the country, and then also some sites in Spain and Canada. And we are all trying to just talk to people with PHACE who are older than 10. And so that's what we're doing now. We're collecting data and recruiting patients. And this, like I said, is open for people. So if anyone is interested in getting involved as a research participant, you can get in touch with me, and I have contact information at the end of the slide. So that is the research in a nutshell and our new project. And then I think Dr. Siegel is going to take it away for a couple of recent projects that have made an impact.
Thanks. But I thought maybe we could pause there. It might be easiest to take questions as we go. We can talk more at the end as well, but if anyone has a pressing question related to that slide, feel free to raise your hand or shout out. Okay, we can keep moving. Well, I am so excited to be here today. I'm Dr. Dawn Siegel. I see so many familiar faces on familiar names anyway on the screen, and then some new people who I haven't met as well. So thanks to everyone for being here today. So I wanted to just go over a couple highlights from the work we've been doing through the registry and through the hemangioma investigator group, and in collaboration with the PHACE Syndrome community. And the first one that was published last year is about evaluating the safety of oral propranolol in PHACE. So this was a really pressing question. So many of you on the call have older children, and propranolol wasn't around at the time when the hemangioma was in the growth phase in infancy. And then about, almost 15 years ago now, it was discovered kind of by luck that propranolol could be used to treat the hemangioma. So propranolol is a beta blocker blood pressure medicine. And we used to treat hemangiomas with steroids, and steroids cause high blood pressure. So there was a patient actually in France who was getting propranolol for the high blood pressure side effect of their prednisone. And then the dermatologist noted that the hemangioma shrunk. And so after that time, we started using propranolol to treat hemangiomas. But in PHACE, people were a bit more concerned because blood pressure medicines could lower the heart rate or lower the blood pressure. And in patients, in individuals who either have coarctation of the aorta or some narrow vessels, there was just concern about the safety. And so people were very cautious at first about whether we could use propranolol. So that was our unanswered question, is it safe to use propranolol in infants with PHACE syndrome who have arterial anomalies or coarctation of the aorta? And so our research goal was to compare side effects or whether any problems came up in infants with PHACE who received propranolol compared to infants who had infantile hemangiomas without PHACE who received propranolol. And so, when we put together several different centers from the hemangioma investigator group, we identified 76 patients with PHACE who received propranolol. And then we had also done a large study evaluating 726 patients with hemangiomas who did not have PHACE. And then we compared whether there were more side effects in PHACE. And the great news was that there was not an increased rate of serious adverse events when treating patients with PHACE with propranolol. And so we did not see any, like, for example, stroke or transient ischemic attack or other neurologic problems or blood pressure or heart problems. There were, the common side effects that we see with propranolol in general, which are some sleep disturbances, some stomach upset, and some wheezing in some babies, especially when they had a respiratory infection. So based on that, propranolol is considered to be safe to use in PHACE, even if there are some arterial or cardiac anomalies. We recommend starting at the lowest dose possible to see if that could be effective. We do like to get the echocardiogram prior to starting, and then if possible, we also like to get the MRI and MRA prior to starting. Although if it's not possible, then we can work with the cardiologist and the neurologist to decide if it's safe, to go ahead and start, because sometimes it's hard to get those imaging studies quickly and the hemangioma might be growing and causing problems that we need to address. So any questions about this slide? Oh, let's see. Okay. All right, so we can move on to the next slide. And so this slide is kind of was the predated the long-term outcome study that we're doing that Mitchell talked about. But we, so many, one of the biggest questions that we hear from new parents is what's going to happen over time, what to expect, what is this going to look like in adulthood? And Alona Frieden just, kind of first understood about PHACE syndrome and taught us all about PHACE as a condition in 1996. So therefore, there's very little information, or there had been very little information about the long-term history or the long-term outcomes of what might happen. And so through the registry, we reached out to individuals who were over 18 years and older to ask, kind of how they were doing. And the good news is that most people were doing very well. There's such a range in PHACE, as you all know, so, some people do have more severe issues and medical problems that arise, but the majority of people are doing great. But of the 18, and this was a very, very small study, which was part of what prompted us to try to, get a larger group of individuals to understand more about the spectrum of what's going on, including, trying to find the people who are doing really well, because they aren't always the ones who respond to the surveys, sometimes, so we were hoping that by recontacting, everyone that we knew of who had PHACE as an infant, we might get more about the people who didn't ever need to come back and see a doctor. So we're hoping to hear about that as well. But anyway, the age range was 18 to 59. So 59 is, pretty good history there. So that was great. And what we did find, which wasn't surprising based on some of the other information we had gathered previously, is that headaches are quite common. 89% of the people who responded did experience some headaches. And then hearing loss, this did surprise me a bit, was that 33% who responded to the survey had some hearing loss, which was a little higher than I might have expected. And again, and also the rate of dental issues was 67%. And so I think part of one of the issues that comes up when you do sort of a survey-based study is that you get a lot of information, but not all of it might be related to PHACE. So people can have dental problems for other reasons that might not be related to PHACE. So we didn't necessarily capture all of that with the way that we designed the study. So I don't think 67% of people in general with PHACE have dental issues. I think it's much lower than that. Maybe
question
around a third. Yeah.
Do you think similarly on the hearing loss?
Yeah.
Is that new hearing loss, or my daughter has hearing loss because of the PHACE, or is that the PHACE hearing loss is getting worse, or they are just experiencing hearing loss as we all age?
I think it was kind of all comers. So it was a combination of all the different reasons. So I don't think the hearing loss was necessarily the PHACE related hearing loss was necessarily getting worse. So it just may have been there from infancy if it was related to the PHACE. And then a few people, may have had hearing loss for other reasons as well.
Thank you.
And then one thing that we're really trying to understand is what happens with the arteries over time, and who might be at risk for having arteries that change, and who are we, more worried than we need to be, or, early on with some of the arterial changes. So right now we kind of our category breaking when we first do our imaging of the MRI, we sort of break it down into low risk. You don't really need to repeat your imaging. Intermediate risk, we want to check again when the child is no longer needs sedation. And then high risk, we want to check frequently every 6 months to a year for some period of time. And we've been working really hard. This isn't really addressed in this slide, but we've been working very hard to try to answer this question, to try to figure out how to read the image reports, and then based on that, who really needs imaging repeated and who really doesn't. So that's an ongoing project of ours. But in this survey of 18, only one reported that their arteries changed over time, which might be lower than we might have guessed. when we first started thinking about this. So we still have a lot to learn. But in summary, the headaches, the things that we kind of knew from childhood, headaches, hearing loss, dental problems, can, come up, can continue to be present in adults with PHACE. And we're still trying to understand how to monitor the arteries. And then there was also, it's not on the slide, but a little bit of issues with some, anxiety and some other neuropsychiatric concerns that came up for some people. And that's also something that we're trying to understand more in our long-term outcomes survey. So that's what I was going to say about this slide. Any other questions on this one?
No, but I would like to say that I'm really excited to do the 10 and up survey because for many years, the few adults that we had actually found our organization or found doctors because they were having some type of medical issue that caused them to seek out help. So I think as we start reaching out or continue to reach out to those that, haven't necessarily looked for help, that will give us a much better idea, especially moving forward.
Thanks, Jill. I totally agree with that. I'm really excited to see that aspect.
Mm-hmm.
Also, I want to plug the registry because why it's important to be involved with the registry. You had said that, was it this study, Dr. Siegel, that you had pulled people from the registry, but it doesn't matter what study it is, if it makes it so much easier for researchers to have this, database of individuals that they can go to for these type of studies. So, we certainly encourage everyone to get involved in the registry so that, more of these studies can be done.
Can I just, can I ask, my daughter's 12 now, and what would be great is to get her own engagement, her choice to engage with this. But I mean, I have to confess, we're a bit out of the loop with all of it, but is there any literature that's sort of age appropriate so she can make an informed decision about how to interact with this? Because I'm sure she would.
Yeah, that's a really good question. When we do for kids who are actually 7 and over, I think when you sign them up for the study, there's a separate form that they also read that's in language understandable to them at their reading level, which is called an assent form. So it kind of describes in basic terms, what it means to be in a research study so that they can decide and have the choice of whether they want to participate. So that's probably the most basic, the most, the main way that we have right now, but that brings up a really interesting question. It would be really fun to kind of try to get some information or literature geared toward younger kids and teens. I'm doing a little, and Anna probably can speak more to this in her section, but in some other things, I've been learning more about youth advisory boards where you engage youth to help decide what the questions should be that we're asking. And I think that's a really neat and important way of addressing some of these questions.
Thank you. I mean, Iola was here briefly listening in, but she's gone now. But it does make me wonder if she was still listening now, she's still looking at these slides. And there's statistics there that suggest that, in 33% experience hearing loss, that kind of statistic, she could go out and Google that and find that, but there's nothing really to put that in context for her. Mm-hmm. So I'm just sort of imagining, as a young person approaching the understanding of the condition that she has, how is it that we can reassure her that, how to take these statistics in context?
That's really important. That's a really important point. And then one other thing that might kind of help with that we applied for a grant with the National Institutes of Health to create a family portal so that we could create kind of a more of a interactive kind of information site where people could, and it would be great. I hadn't necessarily thought about gearing it toward younger individuals as well, or toward youth as well. But that's definitely, if we get this grant, we should have like a kids section that where kids could go and interact with this information and learn. And definitely the PHACE syndrome community would be a huge part of developing that site if we get that funding.
Yeah, and I think even to take it one step further, I think we have adults out there that don't really even understand the best way to disseminate the information that we see. So, educating the adults or the parents of the kids is very important too, because there's a lot of information out there in case studies and things like that, that when you look at, there's, maybe only one individual involved in that research, and it is out there on the internet. And those types of studies can be kind of scary sometimes, and it's accessible. So teaching, our community to understand the difference between these higher level studies that include, hopefully the 100 people that we might get or more in the 10 and up study, as opposed to the, the case study or the smaller studies, and understanding how that can or can't, how it would affect somebody with PHACE. I think it's important to understand those types of tidbits of information that are out there as well.
Yeah, thank you. And Erin's had their hand up.
Yeah, so my name's Erin. Our son has PHACE syndrome. And I have one thing to say, actually, just as you were talking, like a children's book, to their point about how to explain it to kids. So our son has dyslexia as well. And there's lots of books out there written for children on how to explain it to them. And I can't tell you how impactful it was for us to read those with him, for him to understand kind of what he was experiencing. It made it feel okay for him to be experiencing the things he was. And so even just a children's book, to help explain some of this other, because he knows he has PHACE syndrome, he knows it's rare, but I don't think he understands all of what he's going through quite as easily as it was to explain the dyslexia with some of the help of books and things for something that's more common. But what I put my hand up initially for was the hearing loss. So he does have hearing loss, but in the study, how was hearing loss defined? Because he has fluid in his ears. He's 8 years old and has had 8 sets of tubes. His most recent set have fallen out. He gets the tubes because of fluid in his ears and hearing loss. And the ENT said maybe there's a hemangioma in there that's causing his, because he does have a segmental hemangioma on the side of his face. So when the fluid is in his ears, he performs poorly on the hearing tests. But even outside of the hearing tests, we notice at home, like he talks very loud. The TV has to be turned up very high. In conversations, if there's background noise, he'll say what a lot. But in isolation in a booth, he can hear okay, but he doesn't perform like that outside of there. Even the school says too. So I guess I'm just wondering how that was defined in the study.
I think I'm muted. Sorry, my connection dropped for just a second. But how hearing loss was defined in the study? Yeah, so this probably isn't that. Let's actually move on from this slide, because there are some better studies. This study was just asking people, oh, what have you experienced? But it really wasn't that much of a medical, we didn't get medical details in this particular study. There are some really great studies about hearing loss in PHACE syndrome out there. Christina Rasby, actually at UCSF, has done some very good studies where she really characterized, and we had one, Beth Drolet did one as well. And so there's There's the sensory neuro hearing loss, which is more of the developmental, where we think that during development, there might've been some differences in the nerves, and that leads to the hearing loss. And then there's the conductive hearing loss, which is caused either by ear infections or eustachian tube function issues or the hemangioma being in the ear. And then that could definitely improve over time as the hemangioma shrinks down. So those studies, definitely if you want more information on the hearing issues, we could post those. We could maybe, Maureen, maybe we could post some summaries. Because yeah, this is, this was just kind of meant to be just a brief, highlight of what kinds of studies we could do.
Yeah,
but I know that,
however,
yeah, that's such an important issue.
well, just because I think then it might help us to bring to the ENT that maybe isn't as familiar to help with like what kind of treatment plans being developed from there. So yeah, I'd appreciate that. Where do you mean post them? Because I'm not on Facebook. So is there enough?
Yeah, or if you want to, at the end, we're going to have my contact information. And so I could send you those references via email, probably if you reach out to me on the PHACE Registry webpage.
Awesome.
Or Maureen also, if you email Maureen, she could probably email you those references as well.
Yeah,
I have to make sure some of them are public access and some aren't. So if it's public access, we can give you the whole article. And if it's not, then we can give you at least like a high summary, like the abstract that has the details in it. So.
And also, Erin, we'll post that on the website as well. Just give us some time there to get the information and get that posted on there. And I can shoot you an email, and then even everyone as, maybe a follow-up to let you all know. It also would be a good topic for our next e-news. So we'll make sure we put that in there. I'm sure other people are interested.
Yeah. And maybe we could ask, Christina Rasby, I know is still really interested in PHACE. And so maybe you could ask her to do like one of the Ask the Expert columns.
Yep.
I think that would be really helpful.
Yep, exactly. Thank you. Perfect.
Yeah. Let's see. And then there's a bunch of questions in here. And I'll let you talk about your the visual abstracts. That'd be really interesting in your section. And then the vestibular disease. I have to go back, because it's been a while since I read Dr. Rasby's article. But Wendy, are you kind of talking about like dizziness and things like that? Yeah.
Yeah, we had a complete vestibular testing done. And when we got the results, Dr. Perkins mentioned that he would be willing to work with you guys if you're interested, because he has not seen this with his PHACE patients as much. And he would, but they're curious to see if the eye movement is common with PHACE syndrome. They haven't noticed it before. But she put, there's like 3 aspects of vestibular disease that help you with your balance, and she only has control of one of them apparently. So yeah. So we got the normal doctor giggling and saying, well, this is not what we usually see.
Yeah.
Yeah. So, and he had asked, and Dr. Dobbs, what?
There's a couple other kids with nystagmus.
Okay, because
yeah,
it brought up a lot of ideas.
Yeah, dizziness. I feel like I've heard that as well, but this is something that I think we will capture in the 10 and up study, because we do ask about vision, hearing, balance. Yeah. I think it'll come up. Even if we don't specifically ask, I don't think we specifically ask about vestibular.
Yeah, well, the dizziness,
and I think we'll capture it. I think
the dizziness they were curious about because it had increased so much, and she's been like having to sit down and stop moving and just wait for it to pass. to like, it's interfering with her daily life now, and it's increased. And so they were kind of pushing it off as migraines and side effects of migraines. And then they decided to test her vestibular system because Seattle Children's has a really good, it was hours of study. It was not the most fun testing. I mean, it didn't hurt her at all. No pokes or anything, but she did not pass very many of them. And it was like 18 pages of information after that only the doctors that did the study can understand. And he said that it's not a common study that's available at a lot of hospitals. And so he said that he was willing to help if you guys wanted more research and stuff like that. So.
Okay, that's Dr. Perkins?
Yes.
Okay, yeah, I know him. I could definitely reach out to him and see. And Mitchell as well. Yeah, we could set up a call afterwards.
Yeah, he read the results. It's 2 other doctors that actually do the testing and are studying that information, but he would be the person to reach out to you at first.
Okay. Yeah, thank you so much for sharing that.
Okay.
Okay, great. Any other questions about that? Yeah, and okay, so then this is just the last one. This is where I was saying before that even though those numbers were probably, we didn't put too much weight on the percentages on that last slide. That was just from our small sample who responded and what they had to say, and in general. But actually, I think the dental root anomalies and the dental anomaly. So I'm sorry. So to back up, so in PHACE syndrome, we've seen 2 specific issues with the teeth. One is dental enamel problems, so the enamel is not very strong in some people, and then 2 is malformed roots. And so in our survey, when we kind of reached out to the registry, which had over 250 people in it, we really only did come up with about 4 people with PHACE who reached out to us, who told us that they had abnormal roots. And we maybe had 4 to 10 who had enamel issues. And so I definitely don't think it's over half of people that run into these issues. And I do, but I think it's out there and it's important to know about. And I think that the missing teeth could be related to missing roots too. That could be part of the whole developmental process. So I do think whatever is going on, could go the whole spectrum from all the way to having a missing tooth all the way up to a missing root or just missing enamel. But we're still trying to understand exactly why this happens, and so as we understand more about why it happens, then we'll understand a little bit more about what's specifically related to PHACE and what's not. And thank you to those of you who have contributed to our teeth studies. But it is important to recognize if there are dental root problems. And the good news is that just standard care, that you'll be getting with your child when they go to the dentist should pick this up. So dentists, will get x-rays or panoramic radiographs in general at some point early in childhood. And then they could identify that on there. From what I've seen, I'm not a dentist myself, but from what I've seen, is that a lot of times these teeth do need to be pulled when the roots are missing because they won't function very well. So, to prevent problems down the road, it is good to identify this. And we did notice that this seems to be correlated more when people have a hemangioma in the beard area, then those teeth are probably more at risk. Although we have seen some cases where the tooth abnormalities were not, directly related to the hemangioma. Wait, I think I saw something in the chat. when are they typically discovered, at what age? I think the enamel issues can be seen pretty early, even in the baby teeth. So in the first couple of years of life. The dental root problems, I think usually they don't do the x-rays really early. So I want to say it's around, early childhood, kind of early school age is when most of these get identified, maybe like 5, 6, 7 age. So yeah. And yeah, I see a comment that someone who wasn't in the study did have the tooth anomalies. So maybe, maybe it is more common than I know right now. And then someone says that the adult teeth grew before the baby teeth fell out. And so, yeah, that one, I'm trying to think if I've heard of that, but that's definitely, important information for us to consider. That there might be something with the timing of the tooth eruption. Any other questions or comments? Yeah, well, anyway, thank you all. We're getting late on time. I guess I might want to make sure Anna gets her time, but our contact information is here. So, oh, and then just about the registry. So I'm so grateful to everybody who has participated in the registry and to the PHACE syndrome community for supporting the registry. And, it's really all the questions that you bring to us, that help steer us to learn more about PHACE. And we are also, still trying to find, I didn't talk about it today, but trying to find the cause of PHACE, so that's an ongoing area that is very important to us to try to identify. But we don't know yet. And I think it's going to end up being kind of a combination of things, not just like one simple factor, but probably a combination of factors. But anyway, our registry info, you can reach me at PHACE Registry at stanford.edu, and Mitchell is mitchell.braun@ucsf.edu. So thank you so much, everybody.
Thank you.
Thank you. Maria, I see you have your hand up. While we're switching over to Dr. Kerr, to Anna, would you want to ask your question?
Yes, are you hearing me? Hello.
Yes.
I'm from Portugal. I think I'm the only one here from out of the US, right?
No,
Hello?
also me.
Ah,
We have
okay.
a couple, we have a couple people. Very nice.
Okay, great. I have no idea about this PHACE community, and I'm very glad to be meeting everyone now. And I was wondering if we can also participate with our case, with our daughter's case, in this study. Are you still collecting new cases, or at this time?
How old is your daughter?
My daughter, she is 21 months. Actually, she's a good case because she started to take oral propranolol with 1 month age. I identified stage PHACE by myself when she was 2 weeks old, because she was already born. And this was another question that I have got. And then she did an MRI, and we discovered, along with the Dandy Walker malformation, because she has Dandy Walker condition too. They did so with the MRI when she was 1 month old. They discovered she had 2 very narrow arteries, a carotid and another intracranial artery. Well, I don't know if I'm saying this in the right. Are you listening? Sorry. Oh, I'm not seeing myself.
Yes, we can hear you. We can hear you.
Hearing me. Okay. Well, anyway, and she started oral propranolol. The changes were amazing after 1 month or less than 1 month. She already dropped off propranolol, and people don't even know. The changes were like very drastic. People don't notice almost anything in her face right now, and she dropped off with 19 months. So I think she is a good. I have no idea what is the percentage of people with face that also have Dandy Walker malformation. Do you have an
it's about
idea?
a third, probably about 1/3.
1/3.
Yeah,
Okay.
that we have good information on that from all of the MRI reports. So. Mhm.
Yeah, in our
Well,
case,
Dandy Walker spectrum, because there's some mild, I'd say, they have differences in the cerebellum, but not always the full.
yeah,
blown
but
Dandy
she has
Walker.
severe Dandy Walker, and she was diagnosed with very, very severe Dandy Walker. We even she was seen in King's College, the Fetal Institute in London, and they gave us no hope for the child. I mean, they gave us like 100% of odds of severe disability. And what happens is that she walked with 12 months. She runs, she kicks in a ball. She speaks more than 100 words almost in sentences, definitely with a lot of couplets. She sings songs and, like reads books. So she's having a total normal development. So
That's
I also
so wonderful. And these are the stories,
Yeah.
that I really want everybody to hear. So thank you so much for
Yeah,
sharing
so
that.
I also think
Yeah.
that it's important for me to contribute with her story because the images the doctors saw when she in pregnancy don't correspond to the outcomes she's showing. I mean, I don't know, but for some reason her brain managed to find ways to to overcome the brain injury. So I mean, so far so good, right?
So I think Maria, I think what you were asking, because we want to move on to Dr. Kerr so we can get all her information as well. So the
Sure.
question is, you were just wondering if if subjects from outside the United States are eligible for registry in some of these other studies, correct?
Sure. Yeah.
Yeah. Right now, I just am setting up at Stanford. So we're just transferring the registry from Wisconsin to Stanford. And we have mostly gotten through the approval for that. The registry is set up at Stanford, but we don't yet have approval for international. I hope to get it, but it's a little bit more involved with that part. So that'll be the next phase. But I hope we'll be able to add that soon. So if you want to contact me, we can definitely keep you on a list for when we could reach out.
Thank you. Yeah,
with that,
sure.
Yeah, we'll hand it back to
it's so
Dr.
small. Yeah, there's no expression here in Europe or in Portugal. I don't know. There's probably 2 or 3 cases. So, so yeah.
Yeah, definitely in Spain, you aren't too far from Spain. There's some really good Dr. Basalga, and is in Barcelona. It's a little far from you though.
No, I mean, I'm not needing any doctor right now. I just want to contribute, with information about my child, real information for future studies.
Yeah. Awesome. Thank you.
Thank you.
Okay, so we're going to turn it over to Dr. Kerr. She has her slides up. You all ready, Anna?
Yeah, thank you so much. So we're going to wrap up with an overview of some of the behavioral and social science research that has been done in this area. My work has broadly encompassed vascular anomalies. So we invite families who have hemangiomas, venous malformations, complex malformations to participate in what's called behavioral and social science research. And this looks at those knowledge, emotions, perceptions, and interactions of people who are navigating any sort of health-related issue. And my specific research looks particularly at communication and communication with doctors, communication within families, and how that influences your experience caring for a child or navigating healthcare yourself. And so I'm going to review a few studies, 4 studies that I've done. These have been published and I'm happy to share them. These have been published somewhere where if you email me directly, I can share them with you openly. And so I'm always happy to do that. Just reach out to me. I'll share my email at the end and you can see the full study. So the first project started broadly with this idea that parents experience a lot of uncertainty when they're caring for a child with a medical condition. And particularly in rare conditions, we know that that uncertainty is much higher. And so this first research study looked at what is that type of uncertainty? What can we let doctors know that parents are dealing with beyond the medical symptoms? And so this was done at a large vascular anomalies clinic, where I started with 200 hours of observation to do what they were saying, of come up with questions. What are the pressing issues? What am I seeing all of the time? As opposed to being a researcher walking in and coming in kind of blind to the situation. So I did an open-ended survey of 55 parents so they could write long answers. Some people wrote really long, other people wrote fairly short answers. But I asked them about what uncertainty they have, what they're unsure of. And really, we found that there's this multi-layered complex uncertainty that parents are navigating that wasn't just about medicine or symptoms, but it was about their child's future, complex information, lack of information, misinformation, the idea that this is a rare illness and a lot of times it affects other systems in the body, right? And so not all of them present the same way. And then this idea of parental proxy uncertainty, having uncertainty about making the decision on behalf of someone else. When you're not sure about the pain, you're not exactly sure what might be the best decision when the child is too young or unable to express their preferences. And then this idea of social stigma uncertainty about the fear of being teased or the fear of some of the social things that we know can happen. And so the takeaway from this study was really that we hope that these teams of physicians really acknowledge this multi-layered uncertainty and also acknowledge that parents might want to avoid information that might be overwhelming or upsetting and delay it to the future. And there were times that parents said, I don't want to avoid information, but it's overwhelming. And so validating parents in that choice to say, we don't have to discuss everything right now. We're a team and we can do this incrementally. And so after we completed this study, we shifted into looking at decision-making. And so we wanted to know how parents manage uncertainty or in decision-making when they go to that first visit at a large multidisciplinary hospital. And for those of you who have attended these visits, you know there are a lot of clinicians coming into the room. They can last a long time. And so we wanted to tap into what are the experiences of being involved in care decisions in those large multidisciplinary settings. And so we did interviews with 29 parents after their first visit to a clinic. And I did this in a private waiting room. So I caught them right after their visit and said, hey, would you like to come and talk with me? And so I really captured kind of that immediate response. And again, we found similar things, that parents face a lot of information and uncertainty dilemmas, where this initial desire to seek as much information as possible, right? Because it was like nothing was available. My pediatrician didn't know anything. I couldn't figure out what was going on, was often met with this overwhelming amount of information coming from experts who know a lot about this. And so having that ability to kind of filter information, making sure that the environment is not too overwhelming where it can actually be paralyzing or debilitating. And then really parents, what really struck me in this was that they appreciated the ability to make decisions on their own, right? We call that decision-making autonomy, but they often just said, I just want the doctors to tell me what the best thing to do is. Like, I just need reassurance that I'm making the right decision. And so really highlighting that importance of that partnership in decision-making for parents who are navigating this vulnerable and uncertain time. And then we shifted into this idea of uncertainty and physician credibility. And so how does this communication with specialists affect parents? And so again, this was a similar set of data from the same interviews. We just took a different section of it. And we found that parents experienced this frightening uncertainty when they were not able to locate credible information or a credible physician to help them track the care for their child. But when they were connected with those specialists, those credible authorities, that didn't necessarily reduce their uncertainty, but it became more tolerable. It became something that they knew they had a resource they could turn to, that it was something that they saw as manageable and not debilitatingly frightening. And so the study really showed that importance of that early referral to specialty care to make sure that we're giving parents those resources to allow them to cope and move forward, even though we know there's a lot of uncertainty about this. It's inherent that even the specialists have. All right, and then finally, this study shifted to what are the memorable messages that parents of children with vascular birthmarks receive. This was inspired a lot by my own experiences. I was born with a large venous malformation and have had lots of almost comical, but also insulting comments throughout my life, and my parents received some, and I thought this was important for us to capture so that physicians understood what the conversations were when you're out in public and what some of those fears might be. Excuse me. So this was an online survey, an anonymous survey where parents could report the message that they got and then do a little bit of an analysis about it. What was memorable? Was it positive? Was it negative? What were some of the things that stood out to you about this message? And what was interesting, was that some people remembered messages from 15, 20 years ago, that these are messages that stuck with them because they were right before diagnosis or when there was no diagnosis. And so it was this particularly vulnerable time. Unfortunately, overwhelmingly, almost 75% were negative comments from strangers that questioned about their child's appearance. But these positive messages were messages of support that complimented the child, that complimented the parents, and they were memorable because they came during that particularly vulnerable time. And so again, showing this to teams of physicians and saying, how can we equip parents to be able to respond to some of these intrusive or surprising comments that they might get? So that's a summary of the research. Again, I want to reiterate some of the really exciting ways that you can get involved. Being a participant in that research is really important for getting an awareness about this, both of the clinical side of things and the social side of things. Joining advising groups, setting the priority for what some of those research questions are that we should be asking. And then what I'm excited about doing, and hopefully we can move forward in the PSC, is inviting families to be co-investigators on the research studies, that you can be involved from beginning to end in helping design research studies and sharing that with other families and making sure that your story is included in those. So I know that was a quick overview, but feel free to email me and I'm happy to share any of the full studies. We only have a few minutes left, so if there's questions, absolutely jump in. But again, feel free to reach out to me via email and we can have a conversation. So thank you so much.
Thank you, Anna. It's so interesting. And I think that everybody can relate to that study, whether you have PHACE or not have PHACE. It's just really, really interesting. So we do have a question in the chat. Can you confirm that this research was done in the US with private healthcare? And then the second question from the same individuals from Stephen Thompson actually is, what I'm also interested in is the demographic of people in this that the study represented or represents. Has it captured a proportionate representation of people who have a range of understanding and capacity to understand diagnoses?
Yeah, thank you for those questions. So it was done in the US. So it was all people who have private insurance or were connected to specialty care in some way. Some people didn't, and financial uncertainty really did come up often. And that is something that we're finding in a study we're doing currently of people in rural areas and just the inability to access care because of all of the different costs that are associated with it. And then I'd have to pull each article, but I do represent the what diagnosis the child has, how severe the parents rate it, child age, all of those different things are represented in the method section of each study. But we didn't go to great lengths to get like an equal representation across different disease categories. And that's a lot of times simply because we just wanted to get as many parents' perspectives as possible. And it might have limited our data collection, but does effective diagnosis then depend on healthcare they can access? Yes. I mean, I could turn that over to some other folks, but 100% it's being able to be connected to the right people makes a big difference. Or if your insurance won't pay for that visit and you have to see somebody locally who is not as familiar, can really have repercussions on both diagnosis and treatment recommendations.
Mm-hmm. Yeah, somebody did say the UK things are very different too. I think it's definitely different from country to country. And I know that somebody, I think Dr. Siegel, you had alluded to this, like when you're going to the doctors or someone had said something about having this large team, and having to retell your story over and over again really can be very frustrated and difficult, particularly when you're seeking the answer and you feel like you're not quite getting what you're going in for. That can be frustrating. So. But we are just about at our time. I really appreciate everyone jumping on and for this call. And I appreciate Mitchell and Anna and Dawn for being here. This was, it's just exciting to see that we're trying to, do some of these programs and bring our community together, and to see the participation is wonderful. I can see us doing another type of research call. I mean, there's obviously a huge interest in this and having a chance to talk more about, different studies. So it is 1
Yeah.
o'clock. I just wanted to make sure if everyone had a really
Two things.
pressing.
Yeah.
Go ahead.
If people want another research talk and if, like specific topics that they want to hear about, because, there is so much information out there. So we had to just kind of pick a sprinkling, but we'd be happy to come back and talk in more detail. And then about information about the diagnosis, we do have the Facebook that we created. It's online it's still on the Children's Wisconsin website. There's an online link, but we also have hard copies that we can mail to people, which is a great resource to bring to your doctors if you're in an area where they don't know about PHACE. It's technical, it's not really necessarily kid-friendly, but it's an interesting point you brought up that maybe we should do a kid-friendly version.
Well, and also, Erin, to your point, we do have a book in the pipeline here. One of our members have been working on a children's book, so we're waiting to see when that will be published, and then we can get that out to everyone as well. So anyway, I think there's so much more conversation we can always have, and I just want to thank everyone for attending. Have a great day and enjoy your holiday season.
Thank you.
Thank you, everyone. Goodbye.
Thank you.
And the registry will automatically transfer. So I just saw a question about that. So it should still be in. Okay. Thanks, everyone.
Thank you.
Have a great day. Happy holidays, everybody.
Thank you.
Bye. Thank you.
Nice seeing everybody.